Hello everyone, I'm Dr.Ruth.Bassey, a medical officer in the Comforters Place Hospital and IVF Center. So I'll be taking you on to with fertility. Infertility is inability of a couple to actually conceive even after having frequent, adequate sexual intercourse in the space of 6 months to 1 year. Okay, there are two basic types of infertility. That is the primary infertility and the secondary infertility. Primary infertility refers to infertility whereby the couple have never had a child before. That's the man has not fathered a child and the woman has never been pregnant before. While secondary infertility happens when a couple has actually been pregnant, but after having that pregnancy, they have been having difficulty in getting pregnant again. Firstly, for the female, we want to talk about hormonal imbalances. That's where the PCOS comes in, and the thyroid. When maybe there's a disbalance of the thyroid hormone, it can actually lead to infertility. Factor is the age factor. So when it comes to infertility, age is very important because researchers have actually concluded that women that are above 35 years always have challenges when it comes to conceiving. Another cause is uterine factor. So when we're talking about the uterine factor, we're talking about things like the myopathy, that's the fibroid that we know as. We can also talk about endometriosis, adenomyosis, and the likes of them. So when a patient comes to us, first of all, I want to take a very detailed history of that patient. So I want to ask for past medical histories. What have the patient done so far in order to, since the patient have been trying to actually conceive. So that's why I say history taking is very, very important and crucial when it comes to infertility, because you just don't want to go there blinded. You understand? So you're trying to achieve something. So if you don't know the root cause of that problem, you won't be able to solve it. So that's why I want to tell patients to do all their tests. I want to do hysteroscopy. Hysteroscopy is my favorite test because with hysteroscopy, to be able to tell us the environment that the baby is going to stay. Is it safe? Is it conducive? Is it good enough? Is it healthy enough? Do we have any weed? Because weed is something that grows where it is not wanted. So do we have things like that, the fibroid, endometriosis? So during this procedure, we are going to be able to tell if everything is intact. And if there is something that needs to be addressed immediately, we try as much as possible to do it in order for us to achieve a better patient outcome and better results. Treatment is based on patient, like at a particular patient. So we'll not say, okay, because it works for Mr. A, that means it's going to work for Mr. B. So far as all the interventions, all the tests, all the investigation have been done, we will now see and check, okay, is IVF the best thing to do, or should we place this patient on OCPs, that's the COCPs, that's if the patient is having a menstrual cycle disorder or problem, should we place that patient on this particular medication, or should we do a timed intercourse? So what I'm trying to say is treatment is based on the problem. You understand? So we don't just rush into doing anything. We want to sit with our medical colleagues and discuss with the patient which one is best fit for this particular patient. So if you have any question that has to do with infertility, anything related to infertility, please kindly comment below or send us a DM or call. We'll be ready to always pick your call and answer your questions. Thank you very much for watching. I'm Dr. Ruth.Bassey.